Please don't keep us a secret. Tell everyone about Vozetta Telemedicine. Social distancing friendly and virtually free. Vozetta Telemedicine. Give Vozetta a try.
Thanks so much for joining. This is Robert Gabriel, President and CEO of microwizo Technology and also Vozetta Telemedicine. I'm going to be the host for today's meeting. I also have a few other people helping me today. I have Amir Gadalla, the RCM General Manager. He's going to be helping me, and also Nesma, and we also have on the line Abraham. I know it's a confusing era, and I know there's the stress on you and stress on the patients and the stress on everybody. So we're going to do our best to try to make this as simple as possible for you guys. But just a disclaimer, today we're going to talk about telemedicine. We're going to talk about the coding for telemedicine. But as usual, anything we mention, you need to double check it yourself, especially this type of things, because we could get our information from Medicare of New Jersey or New York, and maybe if your Medicare of Arizona doesn't allow that. So please check, and it's impossible for us because to make sure that it works for every single state, because things are changing daily, and it's so hard for us to wrap our arm around everything changing. So we're going to do our best to summarize it. We're going to do our best to deliver it in a way that you will understand it, but please double check it. As things are changing every day, it can vary from one state to another. So the agenda today is we're going to talk about telemedicine. If you don't know about, we have Vozetta Telemedicine that is free, that you can use today. And it works really nice. I'm going to show you a little bit of that. Then we're going to talk about how to build for the telemedicine visit, which is most of you are probably concerned about today if you're doing some type of telemedicine. So I'm going to, what I'm going to do is I'm going to show you quickly a presentation on the telemedicine. Then we get into the coding. So number one is I wanted to show you the doing the actual, so if you go to Vozetta.com, Vozetta was a product created by microwizo, and it is to help physician to book appointments. Now, when I built this 2 years ago, I started 2 years ago, I didn't know that, we're going to have a coronavirus crazy time that we're in, where everybody wants it to do virtual visit. We are donating the usage of this software for the 12 months. So if you joined, there will not be a charge. I don't want to make any money on this during this crazy time. I want to help you guys. I want to make sure that if it makes sense for you, use it. So the way to use this here is, so when you come, then you can pick either a specialty, so you can narrow down the specialty, you can narrow down the area, you can narrow down the plan, or you can use one of those shortcuts. I don't know yet how many physician and specialties going to join us. We're going to change the shortcuts based on who's really using it. So for example, let's say if I just want to see podiatrist, so if I click on podiatrist, and it will go and find me all the podiatrists that use it, and this podiatrist here, Dr. Ashkan, is using the telemedicine, which is I'm going to show you. I can narrow this down. Maybe I only want to talk about, I want to speak to somebody in my zip code. I want to talk to somebody that takes my insurance. So as we building this inventory, this is going to get bigger and bigger. So it's free. There will always going to be a free version, but the telemedicine version, it is free for now, but after the 1 year, there will be a small fee for it. But at least you can use it today to solve the problem where most of you are closed and you're afraid to see a patient because of the social distancing, and you're afraid that maybe you have the virus and you don't want to pass it to your patient, and vice versa. Maybe you're trying to protect your staff and trying to protect your patient. So a lot of practices are closed, and trying to find a way to see the patient remotely without having to be exposed to viruses. Because of that is Congress, regulations been relaxed. So what does that mean? Telemedicine was very restricted, but during the era that we are in, it's a lot more relaxed. Because what does that mean? It means that they made it a lot easier. They made it a lot non-restrict, so you can see almost any patient and you can bill for your visit without having to touch the patient face to face or to patient comes to your office. So they want to force or help you with the social distancing. Of course, if you are seeing the patient face to face physically, then that a risk to you and a risk to the patient. So now they allowed you to do a telemedicine visit, bill for almost any code and able to bill for it, and it's very simple. So I'm going to show you a quick video of where patient were connecting to the physician and how is that going to look. Conduct telemedicine using Rosetta. You can use any device that has a camera. In this demonstration, I'm going to use an iPhone. The patient is looking for an appointment, then clicking on the spot, then now filling what insurance the patient has, picking what plan they have, then clicking the book appointment, and now the appointment is set. On the other side, physician is logging in. As a physician, I do see the appointment. I can start the appointment when the patient is ready for me. So when I click the start, I will see my communication confirmation. Then I'm going to wait for that call button to turn darker blue. Once it turned darker blue, that means the patient is ready for me or connected. Once I hit call, then now it's established. It sends a message to the patient on the other side to accept it. And now I'm ready to talk to the patient and conduct my exam. And this is a telemedicine visit. I'm also able to chat with the patient, and I'm also able to receive and send files to the patient. When I'm done, I end the visit. Okay, so what I'm going to do now, I'm going to introduce Amir, Nesma, and Abraham. They're going to talk more about the difference between a telehealth visit and an eVisit and a virtual visit. I know that's a little confusing, but that's the best that we can do. Okay, good.
Thank you, Robert. Hello, everybody. This is Amir Gadullah. I'm the General RCM Manager for microwizo. I'll be happy to walk you through today on how we can utilize billing for telehealth. As we all know, it has been changing ever since COVID. We're trying as much as we can to keep up with the ongoing changes, and we're going to keep you updated with any changes that might happen. Just like Robert said, with any kind of information that you're going to be hearing from us today, you need to double check it yourself, and you need to make sure that all the information is accurate and correct. I have Nisma with me on the line. She's also going to be helping me with explaining that to you. Basically, just like what you guys are seeing on screen right now, for telehealth billing, there are 3 types of telehealth visits that we can conduct, or telemedicine. So the first one is a telehealth visit. Second one would be an eVisit, and the third one is a virtual check-in. I'll walk you through some major details of each type of visit, so you would know what to bill for your practice. So for telehealth visits, it's an interactive audio and video telecommunication system that would allow you to virtually see your patients, and just you're going to deal with your patient as if exactly the patient's in the office. You're going to do that through any kind of video communication system. Just like Robert explained, Rosetta Telemedicine would allow you to do that, so that you can utilize Rosetta for having telehealth visits with your respective patients. Telehealth visit, it's only for it could be utilized for new and established patients, and that's the only thing that differentiates between telehealth visit and eVisit. As we explained, for telehealth, it's going to be for newer established patients, so you can see a new patient, or you can deal with you're dealing exactly with the patient as if the patient is in the office, and you're reporting it exactly as if the patient is in the office. The only difference is that you're going to be reporting with a place of service 02 instead of, for example, a place of service in the office it's going to be 11. So you're just going to change it to 02. What kind of CPTs or what kind of procedure code that you can use to
One
report?
second here, let me just add to that. So the box 32, if you're familiar with the box 32 on the HECFA form, box 32 is going to be your office visit, the normal office visit, but the place of service is going to be 02, because you don't put your home address, don't put the patient address. So 02 is the place of service to replace 11. 32 on the HECFA form, that's going to stay as it's your office, even exactly. That you are not at the office. That's okay.
What kind of codes that you can use is the normal CPT codes that are in the Appendix B. So you can use 99201 through 99205. If we can go back to the previous screen, please, Robert. 99201 through 99205, that's going to be for new patients. And for established patients, you can use 99211 through 99215. Also, there is a link shared here for all of the codes that Medicare accepts for telehealth visits. This one is going to be shared with you right after the presentation. As I explained also, the place of service has to be 02. And for modifiers, there are no modifiers that has been requested by Medicare to use for telehealth visits. To go to the second type, it is virtual check-in. What is a virtual check-in? It's a brief communication method that it has to be initiated by a patient, and you can use any kind of communication method, like any kind of phone or computer or anything to communicate with the patient. This one is different than the previous one, is that it's only for established patients. You cannot see new patients for virtual check-ins. And the practitioners, they have to respond to the inquiry that was initiated by the patient, as explained, by phone or any kind of audio telecommunication method. Could be a computer or anything else. Virtual check-in, the practitioners that can bill for virtual check-in must have an E&M in their scope of practice, be able to report for a virtual check-in. What are the procedure codes that you can use? It's whether two HCPCS codes that you can use, it's whether G2012 or G2010. So the G2012, if the provider 5 to 10 minutes, has to be with an audio, real-time audio. So you have to you talking to the patient on the phone. G2010, you can actually have the patient, like for example, record a video or send you an image of their case, and they can send it to you, and then you can evaluate that, and you can respond back to the patient within 24 hours by phone, email, or text message. For the place of service, this one doesn't require you to use place of service 02. You can use the normal place of service that you'd usually use at the office. So you would keep your place of service as is. You don't need to change it to 02 for this type of visit, which is the virtual check-in. The only one that would require you to change the data service would be the first type, which is the telehealth visit. This one needs to be to change to 02. The other two types, which is the virtual check-in or the eVisit, doesn't require you to change that. Now, this would be the last one to talk about, which is the eVisit. Regarding eVisit, it's a way of communication between patients and their providers via online patient portal. That's the difference between the first and the second, the third one. So the first one is that it has to be audio and video. Second one, you can use a phone call. And the third one, eVisit, is that you can do it through patient portal. eVisit is similar to the previous one, is that it's only for established patient. It has to be not related to any medical visit that you had with a patient for the past 7 business days, or related to any medical visit that's going to happen in the next 24 hours. So that's the eVisit. That's the regulations of the eVisit. What kind of procedure code that could be used for reporting this type of visit? There are 2 types, for practitioners and for clinicians. For practitioners, they must have an E&M in their scope of practice. So they can report E&M in their scope of practice, like physicians or nurse practitioners or PAs. For clinicians, they must not have E&M in their scope of practice. So people that can't report E&M in their scope of practice can use those codes. So it's categorized to 2 types, whether for practitioners, it's 99421 through 99423, and for clinicians, it's G2061 through G2063. The difference is in the timings that you have spent with the patient. So it's between 5 to 10 minutes, 11 to 20, or 21 minutes and above. The amount of time that you spend it has to be on a course of 7 days. So you calculate this time over a course of 7 days. So for example, if a patient that you're communicating with the patient over patient portal for like 20 minutes, but it happened through 3 different days in 1 week, then you'd report, and you're a practitioner, then you would report 99422. So you calculate the entire time that you spent with the patient in a course of 7 days, and then you report that code. And also for the place of service, you would normally use your typical place of service that you normally use. There is no need to change it to any new place of service. Nesma, I'm done with my part. If Nesma wants to add or clarify anything.
Sure. Thank you, Amir. This is Nesma. I'm the RCM team lead at microwizo. I just want to highlight a part. So in regards to this one, there should be like medical notes or office notes recorded. So there are some parts that needs to to be listed in the medical notes. The provider actually needs to note that the service was done through audio and video, and if there's any like exam or assessment that can be done through the method used, like audio and video, needs to be reported to. And the most important thing is to report the time encounter, like how much was spent on the call, to be able to code for the office visit. And because right now, most of the providers, they cannot go to their office. It can be done from home, and the place of service can be used normally as 02, which is telehealth, and the billing address would be the billing address for the office or the hospital, or the billing address that will be normally used for these types of services. And one more thing to add, that we need to report in the office note the patient verbally consent he is agreeing to the services provided through the telehealth. So that's it for the medical notes part. Thank you.
Thank you, Nesma. Any questions?
I have a question.
Sure.
For psychiatry, those codes of G2061 through G2063 do not apply, because for mental health, you have an add-on code, which is, for example, 99213 plus 90836, depending on the time spent. Do we continue to use the mental health codes?
I think those G codes for
For
non-MDs.
clinicians.
Oh, okay,
Yes.
okay.
So
It's for
continue
clinicians.
to use the same code.
Codes.
Continue to use the same code. The only difference here is you use an O2 as a place of service instead of 11.
Okay, so is there a place in the Medisoft software that you provide to insert that code manually, or do we just have to change it?
Okay. Let me just show you. Not everybody necessarily is using Medisoft, but let me just show you. And you can do the same thing with Lytec or any other software you might be using. So let's say I'm billing Amy here, and I'm billing 99213.
Right.
Now, okay, so you have a place of service here. So all you have to do is just change that place of service to O2.
Oh, so you can change it for every claim you create manually.
Yes.
Okay.
Now, if you want temporary, you can go to that code, and instead of change the place of service here, but the default. So the default comes from the software setup. So now if I make here place of service 02, and now anytime I build that code from now on, and just remember to change it later. So here I can, when I build 99213, it will have, so that will make an O2 place of service. So that's one way of changing it. You can also change it from program options instead of changing it by each code. I'll show you that in a second.
So you can go to File, Program Option, and the Data Entry, you can change this to 02. So from now on, anytime you build any code, it will automatically have place of service POS to be 02. In case that you don't see this place of code on your list, maybe you don't have it hidden, you can click on this black dot and you can add the field here. So you want to take the place of service, so it's either called place of service or POS.
All right, there is a question here that says, are vitals required part of the telemedicine visit? If it's required for a normal office visit, then it would be the same as a telehealth visit.
Okay, I think this is up to the provider. So everybody can probably have a thermometer. Everybody might be able to do to take a pulse. So the provider will be coaching the patient to do things like that. But I'm sure you're not going to be able to do an EKG. Even there's some Apple Watch now has EKGs. But I think really that depending on
the provider should make that determination and decision.
Yeah, so you can basically report vital if it's a part of the assessment, and if it can be done, then yes. The second question is, it says, hi, is video necessary for the visit? Well, video is necessary, yes, but there are some articles that would say no. We don't have a definite answer as of yet on what is a clear update from. It really depends on different kind of insurance companies and different articles that we've been trying to get this kind of information from. But for telehealth visit, for now, a video is necessary for this visit. And that's why we're advising to use Vozetta for this kind of telehealth visit if you wish to report it.
Now, one of the things I heard is if the provider, during the emergency time, if the provider thinks that they can give a good sound medical decision without using the video, you can do that, but only during the emergency time. Otherwise, it's considered an eVisit, not a normal telemedicine visit. So if this is really, it's up to the provider, and it's only during the emergency time, not all the time, just during the emergency time.
So the phone question, it says, what about physical exam in telemedicine? Well, it's not listed that physical exam is needed, but it really depends on what you can do on a call. I mean, if you can navigate a patient on how to, or practice a specific exam, I mean, you can report that, but there is nothing that is listed here that physical exam is actually needed.
So you can go, if you go to the Medicare website, you're going to see there's a lot of exception during we are in emergency time now, that they're loosening a lot of the restriction. It might not be the same all the time. So just go and check with your state and find out what are but the whole goal here is they care for your safety, they care for the patient's safety, and the community having the social distancing. And the only way you can do that is to be able to go back to work and without putting yourself, your staff, and patient at risk. So if you can, now this is not applied to a surgeon, so you cannot do surgery over telemedicine yet, maybe next version, but just kidding. We want you to go back to business. We want you to go back to work. So those are the things you can do and get around, and they loosen all the regulations so you can go back to work.
All right, somebody is asking to explain what is needed in notes. So Nisma can explain that again.
The patient needs to approach the provider to get the services. So the very first thing that needs to be in the office notes or the medical notes, that the provider needs to obtain a verbal consent that the patient agrees to the services, that it's going to be done like through like audio and video. That's the first thing. The second thing, the provider needs to note on the medical notes that these services was done through video and audio. And if there's like an exam or assessment that was done, so it needs to be reported to. And the time encounter is the most important thing to be reported, like how long did the provider spend with the patient on the call, to be able to code for the E&M codes or other codes that the provider will bill for. Of course, the provider doesn't need to be at the office to provide the services. They can actually provide it from home, and the claims for the telehealth will be submitted with place of service too. And the billing address would be normally the office or the hospital, or from where normally those services will be rendered. But for the other like virtual services like the eVisits and the virtual check-in, the place of service will be used normally as the office for the provider. It doesn't need to be the place of service 02.
Okay, let me just show you a couple of examples of what some of our providers or clients are doing. So here, some of our clients are just clicking on their website. It says click here to book a virtual visit. So when you click on it, you will come to Visita to their own profile, and a patient can just book one of this appointment. And as a provider, you're able to link with the patient and conduct the visit through the way I just showed you. And now let me show you somebody else, but they look like they finished all their visit. Okay, so over here, you click on book telemedicine visit, and again, it's going to her profile and listing the available time where the patient can. Now, with televisit, using Visita, when a patient book an appointment, you can actually start that appointment anytime. So it doesn't matter if the appointment is tonight at 11 o'clock at night, it's 2 o'clock in the afternoon, and you can start that visit now if the patient is ready for you. So I want you to think of the Visita appointment list. So when you log in here as a physician, let me log in as a physician myself. So when you log in as a provider, you will see your patient in the waiting. Consider this like a waiting room. You can start the visit anytime you want. So if I click on start, if that patient is ready for me, I'm going to get an echo now because the system is going to go crazy because I'm in the same room and I'm the same person. Okay, so if I do that, You got the idea? You know, as long as the patient is ready at the time you're ready, then you can conduct that visit on the spot like that. So think of this as a waiting room. And I'm going to make an enhancement. I'm going to add more features to this based on the feedback that we get, and share with us any enhancement that you would like to have into Rosetta.
I have a question.
Yeah.
So this application, the patient has to have it on their phone or
No, they can use it from any computer has a camera.
Right, but they have to download the application?
Well, the app is going to be released next week. Right now is you need to log into the website. So you just go to Rosetta.com, and on any device, even their iPhone, and they can just search for you, or they go into your website and click on the link from your website. They can get to your profile, and they can pick an appointment.
Okay, so basically they have to initiate the contact through the Rosetta.
But you have to let the patient know that you are available. So what they probably trying to do is they trying to make sure that doctors are not calling patients, says, oh, let me see you now and let me bill for it. Okay, they're just trying to commit to prevent fraud. So like, you're not soliciting, but you have to let the patient know that you are available through telemedicine. So you use your judgment on that. They just, just as long as there's no fraud committed, that's the whole purpose of what NISMA was reading about. You cannot reach out to the patient to tell them, I want to see you now. So, if there's something wrong with the patient, you get some results and you want to see the patient, then I don't think there's, in my opinion, I'm not, a lawyer or physician, I don't see the harm here.
So if the patient calls the phone line to set up an appointment, they can do that too?
Yes. So you can say, you know what, once you go to my website, click on this link and let's create a telemedicine.
Okay.
I don't think there's anything wrong with that.
All right, I have a question here that says, can telehealth code 99211 through 99215 be billed every 7 days? These are standard E&M codes. They can be billed every day. There are no time limits for reporting those codes. Another question that says, can e-visits be done over the phone only? E-visits are done through patient's portal. What can be done through the phone is the second type of visits, which is virtual check-in. Yeah, that's what can be done over the phone.
I know it's confusing. It's three electronic methods. So let's summarize the three electronic methods. So let's go back to the presentation.
So the first one is, the very first one is that would require audio and video, is a telehealth visit, and it's going to be for newer established patients. The second one is the virtual check-in, and it could be done over the phone, and that's going to be only for established patients. The third one that can be done through patient portal, which is an e-visit, and that's only for established patients as well. I have a question that says, what modifier needed for commercial insurance? Commercial insurances, they report modifiers differently. Some choose to follow Medicare guidelines, and some others would require a modifier. The only modifier that we've heard of that can be used with commercial payers would be modifier 95, and that's with Blue Cross and Blue Shield and United Healthcare. We can use also modifier GT, is for interactive audio and video telecommunication system. But this one, Blue Cross and Blue Shield doesn't accept the modifier GT. It's not accepted. It's not accepted by Blue Cross and Blue Shield.
So how can they bill? How can they bill for Blue Cross Blue Shield?
95.
No, you need 95. Okay.
Modifier.
Where does that go? In the point of service?
No, that's modifier.
Oh, okay. And you can put that in manually too?
What do you mean?
Yes, you can put the modifier.
The
modifier always goes manually.
Okay.
Yes.
I mean, I never used one, so.
I know their mental, it doesn't use modifiers, so it's really not that hard.
So we wouldn't need the 95 in the GT.
No, what I meant is when you're using with certain payers over telemedicine, you never done telemedicine before.
No.
So now with certain payer over telemedicine, mental health never used modifiers before, but because you're doing mental health, you might need the modifier based on the payer. So the mental health is the easiest type of specialty to do telemedicine because you don't need to physically examine the patient or
right.
So all you need now is just place of services O2, and you might need a modifier based on the payer.
Okay.
So when do you need to use the modifier 95?
Nesma or Abraham or me?
I'm sorry, what was the question again?
Who needs the modifier 95?
Some commercial payers. Like, for example, I mean, it's changing every day. I mean, they haven't reported. There isn't a specific insurance company that reported that they would need modifier 95 in the claim to be processed. However, Blue Cross and Blue Shield, United Healthcare, they have mentioned on their websites that modifier 95 can be used.
But this is for telehealth, so do you need to use it for Medicare billing?
No, Medicare, there is no need for any modifier to be used.
They removed it. There were a modifier. This week they came say, you know what? At least New York and New Jersey. I'm not 100% sure that it's applicable to all of the United States, but I'm assuming it is the same. But they came back and removed. They said, you know what? Let's make it simple. All you need, just tell me that's O2 place of service instead of 11.
So when
Maria,
GT versus 95 then? That's not including Blue Cross, when will use GT instead of 95?
Depending on the payer. So some payer wants 95, some payers want GT. Medicare and Medicaid don't need it. Maybe Blue Cross Blue Shield, maybe United, we're not sure.
United Healthcare. Yes, the 95 modifier could be used with Blue Cross and Blue Shield and United Healthcare. And that also answers Maria's question.
Yeah, this is Abraham. From what I can tell, it seems that all, even the private payers, they're accepting 95. Even if GT maybe required 95, would be equally acceptable. So I think that 95 would be acceptable for all private payers, and for Medicare, you wouldn't need any modifier.
Is that a statement?
That's to the best of my knowledge to this moment, that 95 would be acceptable by any private payer, and Medicare definitely does not require any.
And that modifier has to go in because it's virtual. It's a virtual visit.
It's a telehealth visit, correct?
Okay.
Now, my recommendation is the following. Number one is I have people that can help you with that. Go to Vozetta.com and click join and create a profile for yourself as a provider. If you're a large group, then make it an organization. Large group, maybe if you have more than 3 providers. You can create an organization, but most of you is going to do provider and set up an account. It's totally free. We will help you, we'll train you on it. Then we need to let your patient know that you are open and you can do telemedicine visits. We want to send claims as trial and errors. Don't wait until you have 100 claims. Let's send a few claims to different payers and see which is getting paid and which is not getting paid. So the goal is, we don't want to leave your patient not being served. We don't want to leave you without income, because that can bring harm to all of us. So let's go back to business virtually. And I'm here to help you with this. Vozetta is totally free. So use it, set up an account for you. It's free for you, free for the patient. You're willing to, of course, you're going to get paid from the insurance company. But and a lot of, actually, I just received my new insurance card from United about 3 weeks ago, and it has a different copay amount for telemedicine. Each insurance company might have a different copay. So if it might not be your normal copay, it might be a lower pay, but all insurance companies should pay you in full what you normally get in your office.
Right.
That's how I interpret it, how I understand. Until further notice, most likely I'm going to have another seminar like this every Friday. I'm going to post that recording for today and for all future ones, linked to that event. So let me just show you. So if you go to microwizo.com, if the event is in the past, so when you go to microwizo.com and click on events, if the event is in the future or like now, you will click here and you will click start and you join, just like all of you did. But if the event is in the past, so go here and click on events and just change this from a list to like a month view. And when you do that, it will show you, let's say if I want to see the event from last week, so you click on the event from last week, and if you click on the same start button, that will start the recording from the seminar that we did last week. So I'm going to keep doing that. So if you missed last week and you want to watch it, go ahead and watch it. But again, every week there's new information. So I think you need to stay current to this, and no need to go watch the previous ones, but just in case if you need to, because this information changes on a daily basis, not even weekly basis. So expect from us to meet you every Friday about the same time. And if you're not able to make it that time, you can go back and watch it.
Just a quick note, Back in the beginning of March, I created a seminar on how to operate from a remote office or from home. So if you go to microwizo.com, then you go to blog. There is a seminar that I created. It's called Contingency Plan. So when you click on it, you can watch this recording, how to operate from a remote office or from home. If you're not equipped or you don't have the means to operate from home and you need additional staff to help you, microwizo is offering a remote assistant employees. So let me play a quick infomercial on that.
Looking for an extra hand? Well, it had better be sanitized. Or what if it were virtual? I'm talking about microwizo, offering remote employees who can help your medical practice with front desk or back office functions such as answering calls and taking appointments, following up with accounts receivable, running reports, and printing patient statements. A fully qualified employee who is medical billing certified and HIPAA trained is ready to join your team and hit the ground running. Regardless of whether you need coverage for someone on a leave of absence or workforce augmentation, a microwizo remote employee is your best choice at only $475 per week for a full-time employee plus a part-time supervisor. It is the best thing you will do for your practice. Never worry about payroll, sick time, vacations, medical or dental insurance. A microwizo remote employee is an amazing option. Don't compromise. Go microwizo.
You're welcome to reach out to me or Amir or Nesma. I want to thank you so much for taking the time out of your schedule and your family. I know it's a tough time. We all together in this. Let's get out of this. It's here to help you guys. Reach out. We're fully operational, so everybody's working from home. We're fully operational. Thank you again, and thank you for your business. Thank you for joining. Have a wonderful day and stay safe, you and your family.
Please don't keep us a secret. Tell everyone about Bozetta Telemedicine. Social distancing friendly and virtually free. Bozetta Telemedicine. Give Bozetta a try.